Welcome to Docs on Call, brought to you by Northeast OBGYN, with your host, Liz Schatzline.
Good evening and welcome to the program. I'm Liz Schatzline. A lot has been happening in the world of OBGYN lately. A lot of news-making events. Tonight we're going to be looking at some of the more controversial issues, such as the new guidelines for mammograms and any other thing that you might like to ask tonight. I'm very pleased to welcome back to the program Dr. Jeffrey Clyde. He is an OBGYN practicing with Northeast OBGYN here in Fort Wayne. Thank you so much for coming back.
Thank you for having me.
And as I said, tonight is kind of an open mic kind of night. You're going to take some of the more common questions that people have for their OBGYN. So anything anybody would like to ask, that number is 483-8331. Please give us a call. But we do want to start out by talking about all of the controversy over mammograms. Explain to us how the guidelines changed a few weeks ago.
Yeah, the guidelines that came out from the United States Preventative Task Force dramatically and radically changed everything we've ever heard or taught our patients or were taught ourselves. And there's been a lot in the media and kind of a lot of backlash against that because the guidelines really seem focused on the finances of the care and how much money are we spending to prevent cancers and how much are we really saving if we do or don't prevent those cancers. And so we went into medicine to help patients. So that's very concerning to doctors who are there for their patients. We're not there to try and say, well, we'll save a few dollars if we don't treat these women or if we screen these women. And so what we're recommending in the American College of OBGYN and the American Cancer Society recommends is that we still do the mammograms from age 40 and above every year, especially if women have family histories of cancer.
Right.
And we still recommend the breast self-exam because even though the task force said that maybe the breast self-exam that women do at home doesn't have a high yield of breast cancer, what it does do is allow women to let us know if they find changes in their body. And many women do pick up abnormal lumps and abnormal cancers by doing that exam and can get treated earlier. So it's a very simple thing to do, and it's very important to still do that exam. And so we're really doing the same thing we were doing before as mammograms at age 40 and to continue mammograms because it is true that 1 in 8 women will develop breast cancer by the time they're 80. So it really doesn't make sense to kind of try and say, well, maybe we'll take a gamble on you for the first 10 years. And the truth is that every 1,000 women screened, 5 cancers are detected.
Right.
So maybe there's just a few less cancers detected from 40 to 50, but those 4 or 5 women for every 1,000 women screened, you've saved their life and their family and saved them from going through much pain and suffering, and that's what we're there for.
Well, we all have known women in their 40s, and as we talked before the show, even some in their 30s who have been diagnosed with breast cancer due to mammograms. The cancer was found during their mammogram, would not have been picked up any other way. So when you're that woman, and it's your life on the line, these are really scary guidelines that have come out. And Dr. Clyde, women out there are so confused because for years and years and years we've told them, no, you need to get a mammogram starting at age 40. Mammograms at age 40. It was like gospel. And then suddenly the rules change. And women are wondering, how can the pendulum go from here to here? It's very confusing.
I agree 100%. And what the task force found, and this is true, is that for every 1,300 women screened from age 50 to 59, we detect 1 cancer and save 1 life. For every 1,900 women screened from 40 to 49, we save 1 life with dying from cancer. For some reason, they determined that those 600 different tests from 40 to 49 weren't valuable enough, or they didn't want to pay for those to save those women in that category. And that's not right. That's not why I went into medicine. So what I say to my patients and I say to the government or the insurance companies is, my patients are not going to be that 4 or 5 women. I'm going to have them do the mammograms because I want to be there for them and for their health. If the government's doctor, the person on the task force, wants to avoid the mammograms, they can do that. But we're going to do what's right here for the patients. And then the other flip side of that is, it doesn't mean that we have to always react to every little thing we see on a mammogram.
In fact, most things that are picked up in mammograms are not cancer, right?
Exactly, and that's part of it. Is if we automatically just do a biopsy on every single thing, even though it doesn't look cancerous, well, that's wasting money. So part of it is let's evaluate the results, look at the patient, the history, and say, okay, does this really need to be biopsied, or could we follow this for another month or something? And many times that's the key to doing what's right and treating the patient and relieving anxiety.
Okay, and I do want to remind you the number is 483-8331. If you have questions tonight, give us a call. We would love to hear from you. It's really kind of ironic that the technology is getting so much better for mammograms and things, and we're able to pick these things up so much sooner, and now suddenly we're telling women, no, don't come in.
Right. It is a little concerning, you're right, because was this a first test? Were they trying to run it by the public to see how could they control the financial aspect of things as the changes are occurring? And I was very glad to see that not only the patients but the medical community rose up right away and said, no way, we will not sacrifice our patients' health or our health for the cost. We need to look at this differently.
Right, okay. Now, there were also some new guidelines that came out about cervical cancer screenings. Tell us about that.
The cervical cancer screening guidelines change every 5 to 6 years, so that's one thing we have to keep in mind as we talk about these. But they're recommending that we don't do pap smears on women under age 21 because the risk of, or the chance of cervical cancer is very low. Now, it is still present, but it's very low, and they then recommend from 21 to 29 that women have pap smears every 2 years. But what a lot of patients think is that means they don't have to come in to see the doctor at all.
Yeah.
It doesn't address, which we still need to do, is annual examinations, STD testing, bacteria testing, other types of conditions that we need to look for. So we still need to see everyone once a year, but we may not need to do that pap smear, which is just the swab part of the exam. We still got to do the exam. Nobody likes that, but it does have sort of a purpose and picks up a lot of abnormalities that if we didn't do that, we would miss.
Okay, and we have a caller waiting, so
Great.
let's go to the phone lines. Rochelle, good evening, and welcome to the program. You're on the air. Hello, Rochelle?
Yes.
Yes, go ahead. We can hear you.
I just had a question because I had a hysterectomy when I was 29 because I had cervical cancer. So I had to have a hysterectomy. And I'm just wondering, with my age, I'm going to be 40 next month, and I want to know if I'm more susceptible to getting breast cancer because of this.
Oh, okay.
Great question. And actually, Rochelle, it shows an example of why it's still important to do pap smears when you're younger, because that is unusual that you had cervical cancer that young, but it can happen, and we still need to watch for that. So the question is about her getting breast cancer. Is you've probably been on hormone replacement therapy because you were so young to let you still feel normal. So your chances of breast cancer are going to be slightly increased because of the hormone replacement. But we usually say those chances are not double the risk, but 1.5 times the risk. And it's important to keep that in mind, though, because you're still, as a woman and as men too, are more likely to have a heart attack from the fast food we eat and from our diets than to have breast cancer. So I would recommend if you need hormones or if you need the medicine to feel normal, that's appropriate. But I would recommend that you do mammograms and breast exams and annual exams. And your doctor will probably want to start a little bit earlier, maybe 35, to do the first baseline mammogram, since you have a different situation than some other people.
I was going to say, someone like Rochelle, she should definitely be getting in there and having her mammogram done, not wait till age 50.
Right.
Too late. Okay, we have another caller waiting. Nancy, good evening. Welcome to the program.
Thank you. Hi, Dr. Clay. It's Nancy. Love the tie.
Nancy, not a first-time caller, but long-time listener.
Well, I had a question. I just turned 28, and I was wondering, should I possibly get evaluated for breast cancer? Because I noticed something, and you had me evaluated for it, but they thought it was just breast milk from me having my baby. Can it be high up, but it still made me nervous?
Sure, it's a good question, and we still should evaluate abnormal lumps during pregnancy or breastfeeding. Usually those are milk cyst or milk duct issues, but we want to kind of look at those. Most of the time we'll be looking with an ultrasound instead of a mammogram in someone as young as Nancy at 28 for the first look. So Nancy, I would say let's still check that on physical exam, like to see if it's still there, see if it's changed at all, and then we'll kind of take it from there. But the cancer risk for you, Nancy, would be very low. So I don't want you to worry about cancer. That would be extremely rare. I always keep it in the back of my mind. I try not to worry patients unnecessarily because most of the time it's not breast cancer or other types of cancers. It's other things. But we'll check it out, Nancy, and make sure that everything turns out okay and alleviates your anxiety.
Thank you.
And thank you again for being such a great patient and calling in, and I appreciate that.
No problem.
And you're addressing a very good point, because one of the great benefits of mammograms, and I have one every single year, is peace of mind that it gives you, knowing that for one more year things look pretty good.
Yeah, absolutely. And there's a piece to that we haven't talked about with this task force. And reassurance is very important. And so maybe that's something that we need to factor in for the future, because some patients come in and they say, I know I don't need a test, but I need the test for my mental health. I need to be not stressed about this. And there is actually a code. There's a medical code for insurance that we can use that says patient anxiety.
Really?
And the insurance usually will cover it. Sometimes they won't, but it is a legitimate thing to talk about.
It's just really nice when you get that report back that says normal, everything looking good.
Yep.
All right. We have another caller waiting. Jeannie, good evening and welcome to the program. You're on the air.
Hi. I just wanted to encourage women to do the self-breast exam, even though they tell you, you don't have to now. I have a daughter-in-law who routinely did the self-breast exam, and she was only 36, had never had a mammogram yet because she was still too young, and she actually found a lump, which turned out to be breast cancer in both breasts.
Oh, my.
So, it is so important for our young girls to do that exam and to keep doing it, even though they're not 40 yet, but to start young and keep doing it. Just wanted to encourage them to keep doing it. That's all.
Yeah, thank you very much,
Very
Jeannie.
good.
And that's a great example, and I hear those all the time. And we all have family members who found similar things, and I would highly recommend all women continue to do the breast exam. Most women can do it in the shower very quickly and easily. It's a way to reassure yourselves. It's easy to do it. It only takes a few seconds, and so that's something that we have to factor in, how we can do a lot of things in a short period of time to really help ourselves. And I usually tell women they say, well, I don't know what I'm looking for, and I usually say, as you're feeling the breast, cottage cheese lumpiness is normal. If it feels like a marble or a grape, it's different than everything else in the breast, let me know.
Okay. And we have another caller waiting, but before we go to that caller, is there a better time of the month to do a self-breast exam than another?
Thank you. After the period is a better time because there's less swelling.
Okay.
So it's easier to feel and less tender to feel any irregularities.
Okay. All right. Very good. Let's go to the phone lines. Roxanne, good evening and welcome to the program.
Hi, thank
Hello.
you. I have a question. I'm 51 years old, and I had a radical hysterectomy, so there's nothing there. Why do I still have to go and have Pap smears done each year?
That's a good question.
Sure. The radical hysterectomy is done for cervical cancer, and when they say radical, what that means is not only did the doctor take out the cervix, uterus, and ovaries and tubes, but a little bit of the upper vagina around the cervix to make sure that none of the cancer cells were in that area. And so, Roxanne, we usually recommend still coming in for Pap smears to make sure that there's no reoccurrence of those cells. And usually after 2 years, it's very unlikely that you're going to have a reoccurrence unless there was some radiation as part of the treatment, because sometimes radiation can cause some changes in the cells that will show up years later. So then I would recommend just staying vigilant. But that's the main reason. It's more of a precaution because it sounds like you did very well, and I'm happy for that. But we wouldn't want to miss something reoccurring since you are in a high-risk status because of the history.
So as long as there's membranes in there and tissue, probably good to stay on top of it.
Right.
All right. We have another caller waiting. Catherine, good evening. Welcome to our program.
Hello.
Hi, I have a question. I'm 55 years old, and with my last daughter, about 18 years ago, I had to have an emergency hysterectomy. And at that time, my OBGYN told me that I didn't need to constantly come in for pap smears. Well, about 10 years ago, I found a lump on my breast, and I had a mammogram done, and they found a lump, and they went ahead and cut it out, and it was benign. Now, should I continue being careful about this? Because I worry about my youngest daughter.
Right.
Yeah, it's a great question, and everything changes, as I mentioned. So they've changed the guidelines several times in the last 18 years, which I find interesting how they'll come out with new guidelines and, oh, everybody goes crazy, the media gets involved, and a few years later they do it again. And it's funny how all the smart people get together and they decide, okay, now this is how we're going to do it. So I think always trying to take that tried and true, steady approach. Okay, let's look at the whole picture.
Right.
But I would recommend still going in once a year for an exam. Now, you may or may not need a pap smear based on your history, but being checked every year, having your doctor do the breast exam. It also lets us check for cholesterol, lets us check for thyroid problems. It lets us do a lot of things to make sure that in general that things are going well for you, and maybe things aren't horrible, but maybe we can find something that would streamline how you're feeling. With women, a lot of times it's fatigue and tiredness, and they've just felt like that was normal because they were getting older. And usually it's not. A lot of times it's iron deficiency or a thyroid issue, and your doctor might find something and make you feel like you used to feel. So still go once a year and just talk with your doctor about what you need to do this year.
That is true for a lot of women. That yearly visit to the OBGYN is the only time they see a doctor.
Yeah.
That's their physical examination for the year. So you're kind of trying to catch a lot of things in there.
Absolutely.
All right, let's go back to the phone line. Sharon, good evening. Welcome to the program.
Hello.
Hi.
Hi, Sharon. Go ahead.
Hi. I was calling. My mother has colon cancer, and so they recommended that all of us have a colonoscopy, and they found several polyps. And I want to know how often should you continue to go get a colonoscopy after that?
Great question, and I hope your mom's doing well, and definitely prayers and support are very important when someone in a family member is going through cancer. It depends on what she had and what type of polyps they found when they did the colonoscopy. It could be every year, every 2 years, every 5 years. So I'd check with your doctor about that, but you bring up a good point. Polyps usually start in the colon and go undetected for a while, then they can become cancerous. So that's why we recommend doing colonoscopies to get those polyps, if they're there, remove them, and to help prevent them from becoming cancerous.
Especially a family history, you should probably be pretty diligent about it.
Absolutely.
All right. We have another caller waiting. Cindy, good evening. Welcome to the program.
Hello.
Hello, Cindy?
Hello.
Hi, go ahead. We can hear you.
My question is, I had a partial hysterectomy, and I still got my one ovary, and I just wanted to know if I need to, my mood swings has been off, if I have to get some help on that.
Say that again, the last part of the question.
I just wanted I just wanted to see if I needed to get help with my mood swings and stuff. Is that doing with part of my partial hysterectomy or what?
Yeah, I think you may be referring to some pelvic weakness or pelvic prolapse that sometimes can occur after a hysterectomy, or maybe pressure. And so I would say check with your doctor to have him do an exam or her do an exam to see how things are down in that area of the pelvis. Are you having some prolapse? Is there some dryness? Is there some atrophy of the tissues? Because those can affect how you feel on a daily basis and minute-to-minute basis, especially if you're up working. If you stand on your feet a lot, that can make a big difference. So I would check. And you brought up a good point with keeping one ovary. Normally what most people don't realize is each month throughout puberty and then during the premenopausal time, only one ovary each month produces the egg. So both ovaries are kind of competing with each other to see who can produce the egg which then may or may not be fertilized, which then ends in a period if it's not fertilized. And so women with one ovary, still that ovary will just function every month and it will pick up, and they can get pregnant the same as with two ovaries. They'll feel the same, and they'll feel normal until the normal menopause. So that's kind of a neat thing that the great designer, and I call him God, made the body. We have two of many things, so that if one is taken away, the other one still works.
Still keeps on going, huh?
Yep.
Okay, we have another caller waiting. Marcia, good evening. Welcome to the program.
Thank you. I have two questions for the doctor.
Okay, go ahead.
About 4 years ago, I had a complete hysterectomy, and what is good for hot flashes? I've been on quite a few prescriptions, and they don't seem to work.
Okay, hot flashes.
Yep, good question. There are many types of estrogens that work for hot flashes, progesterones, and maybe sometimes testosterone. And so usually what I recommend is ask your doctor to try some of the samples. We get all kinds of samples. So trying to save money, I'll try to have my patients try some samples for a few weeks to see if that's the one that works for you. And if you don't find one that works really well, then one of the compounding pharmacies, that's a pharmacy that actually is old school, and they make up hormones like that we used to do 50, 60 years ago. They can custom tailor the hormones, estrogen, progesterone, or testosterone, to fit exactly what your body needs. And there's also some testing you could do to see where your hormones are at in relation to the medicines that you're taking. So don't give up. I know there are possibilities out there. There's animal-based hormones, there's plant-based hormones, there's synthetic hormones, but there is something that will work.
How long will hot flashes last, Dr. Clyde?
Everybody's different. Some women only have them for weeks. Some women have them for months. Usually if you don't have any hormones, by about 6 months, they should be virtually gone or diminished significantly.
All right. Now, I think the caller had another question, right, Marcia?
Yes.
You still there? Go ahead.
Is colon cancer hereditary, and how far back does it go?
As far back as in the family, I guess I would say as far back as you can determine.
Great-grandfather?
Yeah, but if nobody else had it other than the great-grandfather, then it may not be the hereditary type. Usually you'll see that it's in multiple generations, not just 2 or 3 removed.
Okay, so it may generation skip, but you'll probably see it popping up every now and then on the family tree.
Especially in the cousins or the aunts and uncles.
Okay, all right, we have another caller waiting. Amanda?
Yes.
Yes, go ahead, we can hear you.
Hello?
Hello, Amanda, are you there?
Yes.
Yes, go ahead.
I'm 2 months pregnant, and I just had a biopsy, and they said that I have MRSA of the vagina, and I was wondering, what I should do. I don't know anything about it. The doctor's acting like they don't care.
Oh.
Right, and the MRSA is a scary thing, but in the reason they acting like that, I know they do care, but it's because a lot of us have MRSA, and it usually doesn't cause any problems. What MRSA means is it's resistant to a lot of antibiotics. There are IV antibiotics that it's not resistant to. So a lot of times people have it in their skin or they're colonized with it, but it's not causing any problems. There are bacteria all over our bodies that make things work for us and make our systems work, and then there's some that get overabundant and cause infections. So what they're probably going to want to do is just follow you closely. If you're not having any infection from it, it's not causing a problem, they'll probably recheck you later. But if it is causing an issue, a sore or inflammation or redness, then you're probably going to have to talk with someone about doing some of the IV antibiotics to try and clear it, while making sure that those same antibiotics are not or are safe for the pregnancy and not going to cause any problems.
I understand. People have a tendency to panic when they hear MRSA. I mean, it's a scary thing. Yeah.
It really is. Part of it, though, is that not only could it be a problem for people in the hospitals and in ICUs, but if a patient comes back to the hospital with an infection, the government's not going to pay the hospital for any of the prior care. So the hospitals also don't want you to come back with an infection, even if you got that infection somewhere else. But if you come back to the hospital within a certain period, the government says, we're not paying for anything because she must have got it from the hospital. So there is a factor there that's why they want to eradicate it. so that it doesn't affect the reimbursement issues, which does, it's back and forth both ways.
Okay, all right. We have another caller waiting. Erica, good evening. Welcome to the program.
Thank you.
Hello.
Okay, at 22, I was diagnosed with HPV, and at 24, I have now had an abnormal pap smear. The doctors asked me to come in and have a colposcopy, and I was wondering what's involved in that and what the next step would be after that.
Okay, good question.
Great question. Thank you for calling. And the HPV is a virus that's transmitted through intercourse. That 60 to 80% of Americans have HPV. And most Americans have had intercourse with multiple partners before they settle in a marriage or a final partner. And even then some, after divorces, the divorce rate is high, they might have a new partner sometime in life. So HPV is a virus that gets on the cervix, causes an infection, and can lead to cervical cancer. We know that through these changes in some of the new research that your body should develop immunity to that virus, like it would a cold, and then your body would clear that up. And with a colposcopy, they're just looking with a microscope to see if there's any significant damage to your cervix. They might take a pinch biopsy. It usually takes a few minutes, usually causes a few cramps, but not crazy. And the way to not cause more problems with HPV is limit the number of partners you have in a lifetime, because if you get re-exposed to a new HPV strain from a new partner, then it's going to happen again.
Okay, so be diligent.
Right.
We've got about 45 seconds left, so what do you want to leave with the viewers tonight, Dr. Cly? We've taken a lot of different questions.
I guess don't panic about some of the guidelines.
Right.
Talk to your doctor. Your doctors are here for you. We want to do what's right for you. We're not going to sacrifice our morals or our values because of the financial aspect, and we're used to fighting for you with the insurance companies. We certainly will fight for you with the government, and if enough of us stand up and bond together, then what's right and just will always prevail.
Okay, health is what comes first.
Got it.
Dr. Jeff Cly, thank you very much for coming and
much.
joining us, and thank you for being here. I hope you'll join us again next week for another edition of Docs on Call. We'll be talking with Pain Management Associates. Until then, I'm Liz Schatzline. Good night.
Welcome to Docs on Call, brought to you by Northeast OBGYN, with your host, Liz Schatzline. Welcome to Docs on Call, brought to you by Northeast OBGYN, with your host, Liz Schatzline.